Just wanted to welcome everyone to the second industry breakout series of NUSIS 2021. Some really exciting speakers going to be talking about healthcare innovation, and I will leave it to our moderator, Hina Marfatia, to introduce herself and let everyone else introduce themselves as well.
Great, thank you so much, Mason. So like Mason mentioned, I'm Hinal, and I'm going to be the moderator today. I'm the Director of Operations for VITAL, which is the collaboration organization for this panel, and we are mostly focused on healthcare innovation, so this is kind of our niche, and we're really excited to combine the worlds of healthcare and investing through this summit. I'm joined today by three fantastic panelists who all come from the world of healthcare innovation, but from different avenues. We have Ariane Graham, Teresa Tribble, and Sumit Nagpal, and the first bit of our discussion will be a conversation with our panelists, and towards the end, we're going to be handing it off to the audience to ask any questions that you might have. So you'll be able to come on screen and kind of chat with them one-on-one, but if you're not comfortable with doing so, you can feel free to kind of just drop your questions in the chat on the right-hand side. You'll see that there's an event section and a session section. So in the session section, you'll be able to put your questions there. Feel free to kind of put any questions you have throughout the conversation as well, as I'd be happy to kind of weave them into our discussion as we go. So just to kind of set the scene a little bit about why healthcare and healthcare innovation is super relevant today. In the past year, we've seen the impact that healthcare can have and the lives that it can save. COVID has really revealed a lot of the gaps that are present in our healthcare system. And through the inequalities and disparities present, we're now able to kind of determine more what types of innovations are needed and kind of determine what's prevalent for our population. But more importantly, strategic investments in healthcare innovation are able to be more deciphered now. And there's a lot of spaces where it's sorely lacking. So we're really hoping that through these investments, we're able to bring new opportunities to light and new ideas that can help kind of everyone in the population. And the basic tenets of healthcare innovation, the core of it, is really creating transformative technologies or programs or practices, really anything that's able to ultimately make healthcare more affordable, accessible, and equitable. So with that kind of in mind, and to kind of set the scene a little bit, I'm going to pass it off to our panelists to introduce themselves, their roles, their work, and how they got to where they are today. We're going to start with Ariane. We'll move on to Teresa and then Sumit. So you can take it away.
Thanks for having me on this panel. It's great to be with all of you. I'm Ariane Graham, and I'm Director of Innovation for HealthWorks, which is the innovation and investment arm of CareFirst Blue Cross Blue Shield, which is the Blue plan of the DC, Maryland, Virginia area. So I have built an innovation studio by which we solve existing problems in new ways with the best methods of lean, agile, human-centered design, and systematically find the best and most optimized solutions to those big problems. Prior to that, I spent a lot of time in the digital health space, often on early commercialization and product strategy roles, a lot of that time in Boston. So I started out that part of my career at Patients Like Me, really trying to harness the power of the patient voice in creating real-world evidence and being engaged in research. Then I moved on to Kairos, working on patient access and referral management to keep folks within the network for better coordination of care. And then I was at Quartet for a time working on how do we bring together primary care and behavioral health to identify folks who are high risk to need mental and behavioral health services and link them to the help that they need and close that feedback loop back to their primary care provider. Also spent a lot of time in health equity spaces around health education, like very far upstream with young people, trying to help them, empower them to make healthy decisions for themselves that will serve them for the rest of their lives. And now I'm at HealthWorks. So again, great to be with you and talk about innovation.
I'm Teresa Tribble. I'm an operating partner at The Engine, which is a tech or deep tech fund that's in Cambridge and focuses on climate change, human health, and advanced systems. My own background is primarily in healthcare and life sciences with a focus on early stage companies. I've founded a number of companies and, across advanced materials, diagnostics and devices. Most recently, before I was at The Engine, where my role is really to help our portfolio companies grow. I was the chief business officer of a company called Everlywell, which has made it easy to order lab tests from home. So I joined that company alongside the founder, when there were about 4 people in that company, now has apparently at least 900 employees and has really rocketed. It'd been a rocket ship because it focused on making things easier for normal people in terms of getting access to lab testing. And prior to that, I was a founder of a company that was focused on making it easier to diagnose autism using blood-based biomarkers. That company ultimately didn't work out because the science is much more complex, I think, than we appreciated at the time. But I've generally had a focus on early stage, patient-centric. But unlike Ariane, who's focused more on services, I've been focused more on product and scientific innovation.
Should I go next? Can you all hear me? All right, fantastic. So good afternoon, everybody. I'm Sumit Nagpal. I'm now the founder and CEO of a company, Cambridge-based company called Cherish Health. This is my 5th company over the past 30 years. Company number 4 is still in flight and has just listed intent to go public on NASDAQ. It's a company called Lumira DX. That makes a lab testing device. As one of the 4 founders of that company, I helped create a bunch of its industrial design and software and connectivity for the devices that are now launching. About 100 or so days ago, the company received an EUA for a COVID test. And then everything, essentially accelerated. Company number 5 happened after a bit of a sabbatical that I took. I wound up becoming the global lead for digital health at Accenture, which by all, by everyone's measure is what most people call a career. And that could have been my career, but I'm a builder. I had a fantastic remit at Accenture. Remit was to go and help some of the world's biggest tech companies, biggest retail companies, some of the world's biggest payers, figure out how to deal with this new brave new world of digital health, especially for big tech, big retail, big telco. How to, the next time they came into this industry, not run away screaming. My thesis became that healthcare is coming home, and is the basis of Cherish Health. Cherish Health is helping build. We're another device company at the core. We're building a device that will go into people's homes, but in a way that collects information about people's, highly identified activity without any wearables, without any things that people need to remember to do that don't sustain over time. So the idea really is that we will be able to pick up rising risk, rising acuity about mom or dad, about grandma, grandpa, while they live in their own homes, and help them live longer in their own homes and get them the help they need before that becomes an ambulance ride or a hospitalization. The idea on the one hand to help people live longer with more joy, with more peace where they choose to live. On the other, to help the folks who pay for their care, immediately their families, but also the payers, both public sector and private, to help them actually prevent avoidable cost. So that's the essence of where we're headed. I'm very pleased to be here.
Thank you all so much for those introductions. So I'm just going to hop straight in. I know that I talked a little bit in the introduction about the current state of healthcare innovation, how COVID has kind of impacted a lot of that, and what we're seeing come out of that in a good way, in a bad way. So over the last year, what do you see as some of the most important advances that have happened in healthcare innovation? You can be as broad as you'd like, you can be as specific as you'd like, but just kind of however you want to take on that question. And whoever wants to go first, you could just feel free to unmute.
I'll talk. As we were preparing for this panel, I told a story that I think is probably relevant here. So I was having a conversation with a woman who runs a physician network. And she was telling me that, I said, oh, how's it been going since COVID started? And she said, well, we'd had a 2-year rollout plan to help our physicians learn, and start to adopt telehealth. She said 6 weeks was all it took to get 90% of our people onto telehealth, when push came to shove and COVID happened. So I think, to me, that it's a perfect illustration of design constraints. If you have to do something, suddenly you figure out a way to get it done. And so I think across healthcare, we've seen a ton of that over the past year. And someone mentioned Lucira and, Everly Well, there's been a tremendous amount of innovation in the diagnostic space over the past year. I mean, obviously vaccines, all of those things, and I'll let others, speak, but I've been really pleased actually also with what I've seen come from the FDA over the past year in terms of their willingness to, work with particularly early stage companies to really start to get past the status quo.
Ariane, would you like to go?
Sure. I was just going to say, I don't know that COVID changed our priorities in healthcare rather than just accelerated what we already knew needed to happen, right? Similarly, conversations with friends and colleagues, it's like, feels like we lived through an apocalypse. And what I love about the word apocalypse is like the Greek origin is actually just means an uncovering or a revealing. Like all COVID did was reveal to everyone who hasn't spent their entire career in healthcare that there are vast inequities, that we've built a sick care system, and that there's plenty we can do to deliver care differently than we have historically. And we need to just go ahead and do it. And COVID said, here's your chance. So I'll leave it at that for now.
And I'll actually pick up on what both of you said. It's really interesting that on the one hand, COVID has given us a chance, exactly as you said, Ariane, to uncover a lot of how healthcare works and how it's a sick care system. That all got exposed at a large scale. A lot more people now understand that that's how things work. There's all this tremendous amounts of excitement, enthusiasm about telehealth, which is fantastic, of course. And at the same time, I'll recount a story, early days of COVID, or perhaps a few months into it, where I was on a similar Zoom call with somebody who's thought of as a real innovator, leader in healthcare, a doctor, and she began the call with a fantastic congratulatory message about how everything's changed and how proud she is of the profession, that everything's changed and we were never going back. And then we talked about how to address an immediate crisis in hospital bed capacity, and how to help people who don't need to be in those beds get something a bit more than telehealth, which is a very lightweight version of hospital at home, where they could stay safely at home and be monitored if they had mild to moderate symptoms of COVID after having been diagnosed with COVID, that they could be monitored at home and 24/7 and brought into, or in fact, supported by paramedicine in the home if necessary, all the way to respirator way into their homes if necessary, rather than crowding hospitals with and taking up bed capacity. Three issues with that, as we all have learned over the past year. One, not enough beds get filled, and ambulances drive around looking for beds. Two, people who actually, people don't stop having heart failure, people don't stop having the other conditions that they need those beds for as well. People continue to need their routine care as well, the chemo, the everything else, and resources are diverted now massively. And the third is exposure to our healthcare workers. They're living with massively increased risk from all this inbound sickness that they're dealing with every day. And so it was very logical to go out and talk about, hey, we've now started doing remote consultations. Video conferencing has been around for a long, long time. Great that we're using it in healthcare, hurrah. How about now moving some of the things about where we deliver care into more logical places? How about let's actually go move the dial? And immediately the response became, well, here's all the risks, and here's all the regulatory hurdles, and here's all the privacy concerns, and it was all the yes buts, right? And my point was, well, I think we just underscored the point that nothing's really changed. Yes, we have all been through an apocalypse, right? We've all felt like we have survived, an extinction moment potentially, and we want to feel good about it, and we talk about the easy things that make us feel good about it, but really nothing's changed. And I unfortunately really believe that technology exists that can help move care into safer places. Technology exists, care pathways exist that can help make that care safe. There are lots and lots of innovators out there who've solved, the privacy issues, the regulatory issues, and yet the will to actually make that leap still goes back to the fact that in healthcare it takes 15 to 17 years for an innovation to make its way from a lab into the real world. I don't think that's changed. And that's not the happiest message for a Saturday afternoon, but I think that's reality. I'll stop there.
I mean, I don't necessarily disagree with your assessment. I guess the question is there anything we can do that would, particularly given that the point of this panel is around patient centricity and as a way to think about having impact. What do you think about that?
Should I?
I mean, it's a question for you because I'm curious what your thought is given what you just said, and I think it's a point well taken.
Yeah. So I think that if we, the definition of insanity, you keep doing the same thing, over and over again, and hope for a different outcome. That's what we're doing in general in our industry. We're using new words to describe the same stuff. And I think that the direction you've just pointed in about consumer centricity is the tip of the iceberg, is the tip of the solution, where the solution lies. And I think that the solution lies in a whole new breed, a whole new class of entity that comes in and helps change how we deliver care. I think that's exactly what is happening now. So this is the optimistic message for the Saturday afternoon, where I do believe that there is actually change underway at scale, that it is happening in very strong collaborations across big tech, big retail, big telco, and big payer, right? Major payers are a key part of this puzzle. Self-insured employers are a key part of this puzzle. They're the ones who are footing the bill. They have an incentive to go figure out how to make that money go as far as possible with the best use of that money as possible. And that combination of entities with scale, the ability to operate at scale, with the folks who pay for that care at scale, I think that's where some of the answers are going to emerge from. That's one piece of the puzzle. Second is, I think that there's a whole new breed of primary care provider that is emerging. And those primary care providers are saying, hey, we're not in the business of sick care. We're in the business of health and well-being, health and wellness. And we're actually incentivized in many ways to prevent sickness. that grand coalition between this model of primary care, where there are incentives to prevent sickness, the collaboration between them, technology companies, retailers, and payers, whether they're public, private sector payers or they're self-insured employers. That collaboration is also where there's a huge nexus of innovation. And I think that we're starting to see early signs of that coming to light. We've seen work from Amazon emerging. We've seen work from Walmart that launched with phenomenal results where they're rethinking whether they're in this business or not. We understand that, but what they launched was actually quite game changing with Walmart Health. There are primary care providers that are now out there with clinics in the places where people work that are doing quite a bit to change the experience, where it's not telehealth anymore. It's also, it goes well beyond just a consultation and then an episodic 15-minute consultation that starts and ends within that context. It's now much more about, well, how do we now address the things that we know about? And so I think that this set of players, some of these bigger new players, the players who are more progressive minded, who are actually looking for new ways of collaborating with industry, and of course, technology innovation, stuff that shows up that gives you signals about people as they go about their lives, where you can actually use those signals to say, hey, Mary needs help. And you don't find out that Mary needs help because Mary called for an ambulance. You find out that Mary needs help, 2 days, 2 weeks before Mary calls the ambulance. That combination is going to happen. My message is very simple. That combination is going to happen with a whole new set of players to happen at scale. I hope I've
So kind of on that same vein, not necessarily in a pessimistic lens, but we've talked a little bit about that we see, and I know that we just kind of touched on it, but does anyone else have like any other major shortcomings that you see that are existing in the current offerings that are available in healthcare? So what we are seeing from innovators right now that they should be focusing on instead? Because I know that with COVID, a lot has happened in terms of switching a company's focus in terms of like, okay, like I make this kind of product, but I have to make it adaptable for now. But there are still a lot of shortcomings that are present even with those. Are there any that you think are worthwhile to discuss right now?
I personally, as we've been thinking about what our innovation lab will focus on this year, the theme that kept coming up as I asked CareFirst associates and external partners to tell us like what are the big problems that we should work on is what I'll broadly call data liquidity, right? We sit on mountains of data and we don't have the ability to connect the financial data to the clinical outcomes data. And then even if we could do that, bring it up in ways and surface it to either patients directly or to people who can help patients make real-time health decisions. We gotta figure out how to fix that. Like that, I feel like data liquidity comes up in every one of the like innovation ideas that we even think about tackling on a day-to-day basis.
I guess I can say, I mean, there's tons of shortcomings. We could spend all day point by point going through them. One of the things I think, since I know that this is an investing conference, I guess one of the things that I see a lot of, this is more what I saw in the digital health, when I was more kind of on the digital health side, but it's true in life sciences as well, is not thinking enough about what the so what of what you're doing. So you're starting a company And you're like, it'd be really great if we could get patients to have, I don't know, like a, you know, a way, or not patients, but people could show that they have tested negative for STDs, and you could show that to your new partner, and blah, blah, blah. And they don't think about, well, like what the reality is of that interaction, or I'm trying to think of some sort of example right off the cuff. But like, I've seen a lot of things where people will start companies and they're like, we're solving this particular problem, but they haven't thought about the economics of what that means for all the different players, what the actual interaction is going to be like for people using that product. You know, they design complicated apps for people that are 85 plus, you know, and you're supposed to, you know, it's like, well, it's easy because you just use, it's iPhone compatible only, and, you know, whatever. So I think there's a lot of, you know, if you're looking at companies to invest in, or you're thinking about starting your own company, like that is the number one thing that I think I see in lots of point solutions, is just a little bit of a divorce from the reality of how your thing will actually be used. And that's probably partially what Ariane's talking about, because you end up with all these little data silos for all these point solutions. And it happens on the science side too. Someone's like, I did my PhD in this thing and it's super cool. And you're like, so it improved something by 0.005%. Like, I get that that was like a meaningful outcome for a paper that you wanted to publish, but it doesn't actually change anybody's life. You know, so I think those are the things that when I see innovators who are full of passion and mission oriented, who get caught up in things that are ultimately not going to be hugely impactful for patients because they don't recognize the degree of change that needs to happen in order to get there.
Those, you know, both of you made just huge, important points. I say both those things all the time. I think that data liquidity is getting solved in some ways. I think it's going to get more solved as some of these newer players come into the picture, because a lot of these folks have they live with data as a way of life. Their businesses exist by using data, and they know how to collect it. They know how to make sense of it. They know how to deploy it, and I think we're going to see that. There's clear evidence. A whole set of companies coming into the space. We're not talking about, you know, interoperability standards anymore. They're talking about something at a much more advanced level. Another point I'll make about data liquidity is kind of interesting. What we've learned over the past few years is that actually, as you start extending your view into all of life rather than just the episodes, that the stuff that's locked up in some of these silos becomes far less relevant and becomes far less interesting and important to predict risk. And that there is so much that happens in signals from everyday life that is so much better at being able to predict the risks that we care about, that will actually make a dent in cost, that will actually make a dent in experience, in reducing hardship, in the outcome, right? And we're going to see some of that data, you know, becoming available. It's not just, it won't need to be freed up because it's not in any silo today. It's just not being captured for this use, even though it can be. So, you know, lots of points there. Another point, you know, to Teresa's point, I very frequently say that people don't wake up every morning to use your app. Every morning. You've already lost. And so how do you do things that blend into people's lives, get out of their way, and engage into their lives only when necessary, and stay out of their way for the rest of the time? How do you do that? That's, you know, a difficult lesson for most people building apps and tools to learn. Exactly your point. If something moves the dial, you know, 0.005%, fantastic research paper, you know, You detected something from some signal someplace in an academic setting and wrote a paper about it. All good, but there's a huge gap between that and that changing people's lives, millions of people at a time. That's what really matters ultimately. And people have to figure out how to think about the impact at scale of the idea rather than the idea itself. How do you actually bring it into people's lives in a way that it will become ubiquitous, it will become adopted, it will in fact matter. A lot of startups with great ideas never make that leap because they're too deep, they're too close to the tech, they're too close to the idea, the innovation that they think that never manage to operationalize it. When they operationalize it, it doesn't matter because it's too hard to use. Exactly, you gave the example of, it works only on one type of device, and it's too complicated. Right? All that stuff. I'm long about this topic. I can speak about this topic forever, but really, ultimately, we don't need more tools. We don't need more apps. We don't need more gadgets as much as we need simplicity. We need this stuff to get out of our way, and we need whatever it is to find the right signal to get us the right help at the right moment, and just stay out of our way the rest of the time. That's when we're going to have impact at scale. And that's a very hard thing to do. It's the Steve Jobs thing where, what matters more is than what you put in is what you leave out, or what you make sure stays out. It's a very, very hard thing to do.
And
when you figure that out, you've actually solved the problem. Sorry.
On that note, I just want to share kind of a funny an anecdote. So when I was at Everlywell, we had a digital platform, it returns results. Every time we had a product, have a big product meeting, and the engineering team would be like, so when are we doing the mobile app? And we'd be like, do you really think we need a mobile app? And that people are like, we're like, how about just a mobile optimized website? And it was this continuous loop. But I think Julia and I had this very strong opinion that we were like, do people really want to use an app, like another app on their phone? And so we pulled up all this data that just shows people don't generally actually engage with most of the apps on their phone. They end up deleting them. But it was this funny thing because the product team's like, we make products, digital products. So we'd like to make this app. And we're like, nobody cares. It's not how people are going to actually use it. And to this day, they still don't have one, which I think was ultimately very much the right decision.
Yep. And we made a decision just like that. We're part of what we're doing is building something for people aging or living with health challenges, and there is no app. Well, what the hell's that? And our thesis is that if you have to start with helping someone figure out how to download an app and how to set it up, you've already lost right out the gate. And so, yeah, we couldn't agree more.
Sorry. So I know that we talked a lot about the hindrances that we can see with digital health and technology as an example, but how do you see it being a positive thing or a force in advancing that health equity that we've been discussing and the issues that are seen with, for example, I can't use an app, I don't really know how to do it, I don't have a phone, because that's often something that I've seen with a lot of patients that I've interacted with. Either they have one of those flip phones that all the kids nowadays make fun of, or they just aren't able to afford it. So how do you kind of see the marriage of digital health and technology moving forward, especially with, I know that there's been a lot of talk about COVID passports and getting that to be able to get into venues, for example, things like that.
Yeah, for someone who's spent most of their career in technology, I'm kind of a Luddite when it comes to these things, and particularly when it comes to health equity, right? equity asks who is not in the table, sitting at the table, who is not in the room making decisions. And everybody's driving the technology and healthcare decision making is often like not representative of the people who are at the base of the pyramid. And that is a problem. And public health gets that. Public health has been talking about equity for decades. Digital health is just now locked into this as something that they want to pursue, and still hasn't quite gotten the fact that a bunch of people sitting in a conference room or now at home in Silicon Valley deciding what is best for people who carry flip phones and not smartphones is not going to work. What public health understands is that the most effective strategies are community informed. They are developed in partnership with the people who are your end users. And I don't think digital health has figured that out yet. But I do think that digital health can be helpful in automating, streamlining, making more efficient the things that need to be automated so that we can keep humans in the loop, right? I worry about some aspects of artificial intelligence when they take the human out of the loop of what should be happening, right? When you think about people who don't trust the medical establishment, why should I trust an app more than I trust someone who either shares my lived experience or at least can empathize with it and say, I hear you, I understand what you're saying, I am vested in your health, and so we're going to figure this out together. I don't think an app solves for that problem in the same way me trying to get a doctor to listen to me when they don't share my lived experience is also not helpful. I need a trusted messenger and a trusted connection, and technology can take care of like, how did we get together in the same room? How did that appointment happen? How did that provider have the right data to think about how to even assess my current health and create a pathway to better health?
I'd love to have you come and speak to my team. But look, you know, I simply couldn't. You just said it all begins with empathy, and that's not just a word. It carries a huge amount of meaning to it. That entire understanding of someone's experience, when you actually put yourself in their shoes, when you actually feel it, is when you get it, and that applies to our industry in spades. Your point about people designing for experiences they've never had is exactly what happens. That's the pervasive model. And no amount of focus group thinking, no amount of socially distanced market assessment teaches you how to put yourself in people's shoes. That is one of the hardest things to do. We've launched a campaign to give voice to the people we're going to be serving. There's an entire movement we're trying to create around it, and that is actually how we're building our empathy with the people we're serving. If we can't figure that out well enough, we're going to fail. And I think that's where all this begins. All the design principles, all the UX principles that have come into being over the past many years are completely irrelevant compared to empathy. Yes, all of that matters once you've figured out how to solve someone's problem in a way that's going to work for them. How to even understand what problem it is to be solved. Start there, then work backwards, rather than, hey, I know how to build an app, or I know how to build a device, or I have a device. Why aren't you using it?
Teresa, did you want to add anything?
Beautifully said, both of you.
Awesome. So on that same kind of thread of thought, we were talking about that there are a lot of communities that are being left out, and there's a lot of people that aren't getting the healthcare that they do need, regardless of how many innovations are coming out. And I think we've seen that a lot more, particularly in the last year, or it's been brought to more light in the last year. So what communities specifically do you feel are being ignored or underemphasized by the current landscape? And how do you foresee it changing, whether it be through the innovation side, whether it be through how we're approaching it on a really wide, like broad spread healthcare kind of system basis? Because I know there's a lot of argumentation about that as well, and how we can incorporate, like, for example, a Medicare for all or single payer plan throughout like healthcare innovation as well, or through like private systems versus public systems, things of that nature. It's a heavy question, but
Yeah.
My response to Ariane, she can take all my airtime on the.
Well, I'll focus in. How about that? I think in the same way Teresa said, there's no shortage of shortcomings. I could go through them point by point, and we could talk about every community that has been like actively hurt by our current healthcare system. I don't know how useful that is, but a thing I've been thinking about, and I admit that I'm fully biased in this regard, because my immediate prior job was at March of Dimes, is I've been thinking a lot about mothers, right? So we have an actual maternal health crisis in this country where Black and Indigenous women are like dying in childbirth, like more so than anywhere else in the developed world, more so than in some developing nations. That's a problem. At the same time, lots of women across the board are experiencing life-threatening postpartum events that we are not treating. That all is a problem. But to Teresa's point about the so what, we know that whether or not mom brings in the household income, mom makes most of the healthcare decisions for that entire household. So if mom is not healthy, the entire household is impacted, perhaps the neighborhood, perhaps the community. And that has impact for everybody's health. So a person or a persona that I'm thinking a lot about is how do you lift the health of mothers and like thereby lift the health of the entire family, the household, the community in doing so. And I think, you know, I don't have a lot of conversations with people who are like not interested in race, class, health disparities and be like, we should all be treated the same. I don't believe that. But what I will say is if you lift the health of the people who are most marginalized, you actually do lift all boats. If we state that we care about mothers and every single one of them, and we treat them as such, we actually do lift the health of all mothers. And I'll pause there.
Well, you know, in a similar manner, my blinders are people over 65 at this moment, because I'm just, you know, focused on that segment of our society, you know, not just in the US, but globally. And the challenges that they face are very, very similar around the world. Beyond a certain age, you're sort of left behind and forgotten. And there is an that will happen to you, and there is an expectation that that's okay, because hey, we're making room for the next generation, and you know, you've lived your life. We've seen the impact of that during COVID on our parents or grandparents, right? We've let them down really incredibly badly, and we've seen that writ large. Our senior care facilities, care homes, etc. I mean, they were the epicenter of a lot of bad things that came to light during COVID. It's not that they weren't happening before; they were just they were concentrated during COVID, because you know, you're sort of dependent on these institutions working for you, and they didn't. You're dependent on these institutions caring about your needs, and they failed. You know, with rare exceptions. There's always exceptions, but we saw what that caused. And as we go into the end of this decade, there are going to be more people over 65 alive than under 18 in most developed nations. Some nations have already reached that threshold. And so, you know, I think there's that. And then we're all living longer. And we're all living longer wanting more freedom, more joy in our lives. We're wanting more fulfillment later in life. And those are serious societal challenges that we're going to have to deal with. And so I think that entire demographic is there's a lot of activity, investment activity, venture activity around, quote, aging. And it's all in recognition of what I just described. I think that there's both opportunity there, there's room to do tremendous good, there's room to produce an impact on the obvious impact on healthcare spend that this demographic will cause, this shift in demographics will cause, right? Our spend will just go through the roof if we don't deal with this. And so there's lots of reasons to go solve these issues.
Awesome, thank
I'll
you.
stop there.
So with just 10 minutes left of the panel, I'm going to switch gears just a little bit. We'll come back to these more, like these really, really relevant and super important topics. But I'm going to take a little step back and open it up to our students that are in the audience, kind of get a sense from them what they're thinking. So from Mason, from more of like an NU impact investing kind of perspective, healthcare is an industry that is often hard to source for, mostly because health technology companies often need a lot of capital to kind of get what they have off the ground. And Sumit, as a serial entrepreneur, I'm sure you've seen that on a very firsthand basis. Do you have any advice on types of things to look at or any recommendations of how to go about it?
What check size does New Impact typically write?
I'm gonna
You don't know because
pass that to Mason.
You're the organization. I mean,
I believe that they have written, I think their latest investment was about 20,000. I could be wrong. Please put it in the chat if I'm wrong. Mason said 25 to 30K. 25K is the standard. Yeah.
Okay, great. Yeah, I mean, I think that is a check size that's useful. I mean, if it were me, I would probably, and I were you, I would probably focus on finding sort of more digital health type solutions, because those are less capital intensive, that can be prototyped quickly, and that probably actually are relevant for your for the demographic in which you live, you know, college students, young people. That would be probably where I would go, because it's more likely that you're going to have entrepreneurs around you that are doing that. I mean, the nice part about being in Boston is it's a hub for healthcare. Probably the hard part, if you're trying to invest as students, it may be harder to get into deals because there's just a lot of capital and people around.
Well, here's a thought around, being able to do something with very little capital. Just give an example. There's a company called Papa that started as an idea to connect students with folks who need help as they're growing old. It was a fantastic idea to address loneliness, to address people's needs to, do simple things like getting their groceries done, or go from a place to another, just make their way to a doctor's appointment, etc. That's now grown into a fantastic, well-capitalized business. And it didn't need too much digital enablement beyond some logistics and, a way of connecting people to people. There are even fantastic apps like Nextdoor that do that already. Plugging into those is an idea. These services should just become a part of those ecosystems, because people are already living in those apps to get all sorts of things done. Right. So there are lots and lots of ways to think outside the box, where you can get very far with an idea that solves a real problem, without having to go spend huge amounts of capital to build a gadget or build an infrastructure. Like, the gadgets and the infrastructure are sort of later, right? The power of the idea, and then finding ways to do it without making people do yet another new thing, that's powerful. And I think Papa did that, and I think Nextdoor is a great enabler of that. And so that's a place to go deploy $20,000 very much more effectively.
Great. Ariane, did you have anything to add?
No, I'm not the big investor on this panel, but I'd say like I wish I had gotten involved in this kind of organization when I was undergrad. Just the practice of evaluating different spaces, different industries, different technologies, and like making trade-offs with limited capital is just a useful skill to have. Like similar to business school, like going through the case study method and making the decisions of a leader with imperfect information, but having to move forward just became a really useful skill to have over time. So.
Great, thank you. So the next question that we got was more along the idea of students and those in college looking to get more involved in the healthcare industry. You're all in different spheres within that. Do you have any recommendation of places to look for experiences, internships, things to consider as we're making our way through? I know a lot of us potentially, like, we're graduating soon and there's a lot of uncertainty in the world. So is there anything that you would recommend really just trying to get a foot in while it's still young? Yeah, Sumit.
I started my career in strategy consulting and life sciences, and I recommend that if you're not totally sure what you want to do, but think you want to be in a space, because I got to see a lot of different, projects, got a good feel for the industry as a whole, and that enabled me to, move in different directions pretty broadly. So that's one, that kind of internship was really useful, or that kind of job was really useful for me. I also, I was really interested in actually, Sumit, we haven't talked about this, but like I did an entire year's traveling fellowship on aging in different countries. And I've actually been really interested in aging since the late 90s. It was not quite so normal then to be as interested in that when you're like your early 20s, but I also did legislative internships. So I worked on Capitol Hill for the Senate Special Committee on Aging. Got a really good handle of kind of the overarching governmental programs, which are the backbone of American healthcare. So to me, those two places are, I don't think you'd ever regret doing that type of work. And I'm not a scientist, so that whole thing too, right? Where you could go work in a lab if you wanted.
I literally can't top that answer. I so totally agree that exposure is so important. Even in my time at Accenture, I met so many young people, recent college graduates, who are so super sharp, so motivated, so inspired, learning every day, in that exposes them to so much stuff around the world. Like that, I wish I had that when I was that age. It's a fantastic exposure, and that or legislative exposure, I can't top that answer. I totally agree. The only caveat I would say I would put there is, if you've got a driving passion, if you already know what you want to go do, then obviously go find places where they'll deploy you and set you free, right? That exists. We're surrounded by that in Boston. If you're a machine learning person, or you build sensors, or you figured out some novel chemistry, there are companies looking for you. Right? There's somebody I know who's just a high school but phenomenal programmer. Thinks of that as life, and so there's tons of opportunity for people like that to just go deploy their passion.
I agree with everything you said, and I just want to give a word of encouragement to people who are looking to leave undergrad, leave business school, make a career change in these uncertain times. My hunch, as I talk to other employers and such, is like, if you were ever going to make a change and take a risk, like now is actually the time. I think a couple years out, when someone looks at your resume and says, what were you doing in 2020 and 2021? You can say, I went and explored something because like we were living through a pandemic, jobs were scarce, etc. Like, have a clear story about why you made that decision, but don't think that you are going to be locked into that decision for the rest of your life. The black swan event, like, be able to tell the story when you need to, but don't be afraid to go try something.
I have a 13-year-old and a 15-year-old, and that, you know, is completely relevant to their lives. I totally agree. Yeah.
I don't want to ask you more questions because I want to put on that very optimistic note, and coming from someone who is in a position where I have had that kind of back and forth of, I want to do this, but I also want to do that. And it kind of feels, it sounds dumb almost to say it, but like when you're a senior in college, you're like, I don't have that much time. It's like you have all the time in the world, but it kind of feels like all the pressure of everything is coming together. So hearing that from all of you is really great and super encouraging. So thank you all very much. And we're basically done. It's 1:40 on the dot. So thank you, our panelists, Ariane, Teresa, and Sumit, for your wonderful conversation. I'm sure we could keep talking for 2 more hours about just health tech literacy and health equity in general, but it's been a really great conversation, and thank you to everyone who joined us today. I really appreciate the opportunity to get to talk with all of you.
Thank you.